Hey everyone, welcome to our first episode of our FARIL podcast. We are the Foot and Ankle Research and Innovation Lab. My name is Samir Ghandour. I'm one of the research fellows here. And today I'm joined by my colleagues, Bedri Karaismailoglu and Omer Subasi. Why don't you guys introduce yourselves, starting with you, Bedri?
Hi everyone, I'm Bedri. I'm a foot and ankle surgeon from Turkey, currently a research fellow in FARIL. I'm happy to be participating in podcast.
Hello everyone, I'm Omer. I'm one of the postdoctoral researchers here. I have a mechanical engineering degree for my bachelor's and a PhD in biomedical engineering. So I'm one of the very few engineers working at FARIL. Thank you for having me in this podcast.
Yeah. Well, it's interesting to have you guys here across the table and when we're working together upstairs. So it's going to be interesting to go on with this. So the reason why we have an expert orthopedic surgeon and an engineer here today is because we want to talk about something that involves both of you, which is PSIs. What are PSIs and what do they stand for? Why don't you start off, Bedri?
Yeah, of course. So as a foot and ankle surgeon, I am participating in a lot of clinics, but when it comes to some specific problems, I always kind of have difficulties with solving them. So 3D printing, when I first heard of 3D printing, I just thought like we can do a lot of things with this technology. And I think there are many aspects that we can talk, but patient-specific instrumentation is kind of the biggest part of it. So we call it as PSIs, as an abbreviation of patient-specific instrumentation. So it just provides you the best anatomical model of the patients that you can just obtain from the computed tomography image of the patients, and then you can just apply those images to your surgical plan, that you can plan ahead what to do, and also you can just 3D print of your ideas, including the surgical guides. Not only that, but also you can print patient-specific implants that fitting perfectly to the patient anatomy, not like the mass-produced ill-fitting implants available in the
Yeah,
market.
yeah. And before we go into more details about examples, Omer, could you introduce to us or explain to us how we 3D print these PSIs? What kind of material do we use? Just give us an idea about for those people who aren't familiar necessarily with 3D printing.
So the options for 3D printing is actually quite diverse, and it depends on your specifications, what you're going to model, for what cases you're going to model your design, and there are a lot of things to consider. Well, the first one is your 3D printing method. As we know, right now there are many different 3D printing additive manufacturing methods, and we use some of them in our lab. We have the filament fused deposition modeling printers. We also have some stereolithography SLS printers, and we've recently acquired a state-of-the-art powder selective powder sintering uh, instrument. So that's one consideration. Another consideration is obviously the material, because you have a huge range from metals to biocompatible polymers to composites, and even research is being done on bioactive materials that's going to activate when it's implanted inside the patient. So there are all these different facets from an engineering perspective that we have to bear in mind while trying to tackle a problem that can be better solved with these new additive manufacturing solutions compared to what we were using before, which were more traditional subtractive manufacturing methods that are usually to manufacture metallic implants, orthopedic devices, prostheses. But one of the things that 3D printing enables us is especially patient specific, because we don't have to depend on these old and uh, more limiting subtractive manufacturing methods. With 3D printing, we can actually use the patient's own model
Mhm.
to specifically tailor to their anatomy, their specific case, bearing in mind all these patient-specific factors. This is what 3D printing enables in orthopedics.
So how do we 3D print an implant or an instrument using a patient's model, right? Could you expand on this, Bedri, a bit?
Yeah. So we know that every patient is different from each other, so every anatomy just differs a lot. So by having the detailed images of the patient, this can be a better computed tomography or magnetic resonance imaging. So you can use those images, which are mostly in DICOM, and you can make anatomical models out of them, just perfectly the same size of the patients, whether bones or ligaments or something else. So then you have the patient in front of your computer, so you can play around, do make some surgical guides. You can replicate your surgery even beforehand, going into the OR, and you can just like precisely decide what kind of surgery you should do, what amount of correction you should do, and that's not only that, but also you can 3D print your ideas that you have, and then you can take them to the table, to surgical table, and you can apply those ideas to the patient. So of course there are many different materials that you can use, but one of the biggest part of the patient specific instrumentation is the implantable materials. So if you have the technical capacity and engineering capacity to do that, you also have the chance to actually produce some implants that can be implantable to the patient, and that brings you that kind of avoids you to use any kind of general materials
Yeah.
that is not really good fitting to the patient.
You spoke about the technical and the engineering capacity to build all these patient-specific models. I mean, this is still in its infancy, right? Where we were recently working on some of the PSIs that you were designing, and this is not something that's widely applicable and used. How feasible is it, do you think, as an orthopedic surgeon, to have this, be on a larger scale and used widely in hospitals and especially in the orthopedic surgery?
Yeah, I think that's a good question because not everybody is really into 3D printing and modeling. So as a surgeon, I'm also interested in such things. So I do some part of the work myself, but I also need some support from my teammates. And those need to be the engineering part. So I cannot really do everything by myself. And when it comes to the surgeons, it's not supposed to be like you have to know everything. So the teamwork is the key. You have to really have good engineers and supports from your colleagues to make this processes going. So nowadays, the company is actually taking up that role because it's not easy to build that team in each center itself. It might be easy to build in some big centers, but not every center and not every surgeon can actually reach out those people. So the companies kind of provide these processes through their own teams and can help the surgeons to do what they want actually.
Yeah. So yeah, that's very insightful. But I would want to know, because Omer, you were mainly like responsible for 3D printing all the stuff that we kind of throw your way here in the lab. And I know, thank you for bearing with all of us and our designs.
I'm glad I'm helping everyone
yeah,
here. It's a collaborative work.
So Bedri touched on the kind of modeling part, right? But you still need to print these things. And
Yeah.
so what are the challenges and what are the difficulties that you might face when you want to expand this on a wider scale and for surgeons to be using almost on a daily basis to perform their surgeries?
Yeah, so obviously one of the things that's stopping 3D printing from becoming a mainstream way to manufacture implants is right now obviously the cost, because with traditional methods you just automate your manufacturing system and the machine you just let it be and it follows a code and just mass produces implants. But if you want something to patient specific, you can't just go for mass production. You have to treat each case individually, model individually. So that's not only a cost in manufacturing time, it's also a cost in effort and dedication in the staff that's going to be working on this patient specific model. In terms of other challenges, so obviously it has to be as Dr. Bedri mentioned, it has to be collaborative work. Not you can't just do this with a team of surgeons and doctors. Engineers have to be who are more well versed maybe in 3D modeling and who knows the uh, ins and outs of manufacturing. So building a team of that size might be a challenge right
Yeah.
now. That's stopping the 3D printing becoming more mainstream.
Yeah. I want to move on to talking more specifically about some of the PSIs that you have been working on here at Bedri. Could you give us an example of one of the PSIs and how have you been using it in the cadaver lab recently?
Yeah, we are making some research on newly developed ideas, surgical guides, and even different kind of aims. So basically, when you try to summarize what you can do with 3D printing, like patient-specific instrumentation is one of the biggest part of it. And we do have some surgical guides designed for subtalar arthrodesis and also the tibio-telecalcaneal fusions that provides easier way to put your guide wires and your screws, your implants, so you can significantly decrease your surgical time, because it's mostly painful to put your guide wires to those patients with a lot of deformities and problems. So it is a patient specific instrumentation, I can say, but of course we also make some research on other things. For example, we have the semicircular wire guide, so that works with the circular external fixators, and it provides a good trajectory for your fixation. So it's actually an addition to the available equipment that you have. So that's another way of 3D printing. So you can print some ideas of yourself and match them with the current equipment to make them best out of your available equipment.
Right. And if so, let's say we kind of figured out how to build these PSIs and or 3D print them, sorry, on a wider scale, and we're able to adopt them in our daily practice, right? What is the number one advantage that you think? I mean, you touched on making surgery easier. I mean, from my end, I mean, I'm not an expert, but I would say it would standardize things more, right? Like you would have more standardized approach instead of every surgeon freehanding their own way. And
Yeah.
what are your thoughts on that?
Yeah, definitely. I mean, not only it improves you as a surgeon, I think it also benefits a lot to the patient. So,
Right.
For example, like you can have shorter surgical time, you can have easier surgery, which is good for a surgeon. But at the end of the day, it actually benefits to the patient, because this less surgical time means less duration of trauma, less duration of blood loss, and less duration of anesthesia. And also, if you can reduce the radiation exposure, which is one of the aims that the patient-specific instrumentation have, so you are actually aiming to put all your implants in one go, rather than just trying to see whether you are in the right place with the fluoroscopy, and which increases a lot of radiation exposure. So that also benefits yourself with less radiation, and also to the patient, because it's also less radiation for him. So it's like it works in both ways. Not only just helps the surgeon, but helps the patient also. With less surgical timing, it's quicker recovery period, and also with less complications, that we can say.
Yeah. And from an educational standpoint and from training rising orthopedic surgeons, do you think this is something that residents should be learning how to use, or do you think they should start off with the basics and then maybe later on move on to PSIs or learning about using PSIs?
Yeah.
Is this something that they should have as an integral part of their training, or is this something that they can have as an extra or extracurricular kind of their training?
So yeah, I mean, although it's not a new technology, we know it's just new for surgeries, but like it's not widely used. Actually, it's not mainstream. So, but I believe that as we talk about the future of the healthcare and the surgeries, the 3D printing and PSIs will be having a really important part. Actually, it will not be a choice. It will be mostly a necessity to use them. So I think, especially in advanced centers, there needs to be a place to mention those things and maybe give an idea to the to residents or fellows, because if they don't know anything about it in the future, they cannot really keep up with everything that we have. So if they can have a basic about the subject, and also how it is working, how it can help them, it will be easier for them to later to be more inclusive in this kind of
And I
environment.
think it's very important not only to for them to learn how to use these PSIs, but also to learn how to model, right,
Yeah.
using the imaging techniques, and how to actually
Yeah,
adopt this kind of technology instead of learning how each PSI works or
Yeah,
what their uses
you know
are.
what?
Because that's something, if you're an experienced orthopedic surgeon, you can use any instrument,
Yeah,
right?
you know what? Like, I think it really adds a lot to the surgeon, because you have all the 3D imaging in your head, and it improves your ability to think 3D in the surgery. So, I think it really changed a lot of practice, because if you have just 3D image, 2D imaging, just the X-rays of the patient, and you don't see any 3D model of the patient, then that's really hard to handle in some cases, because you cannot really understand which fracture line going where. But if you have it in 3D, and if you are able to do it yourself, like 3D segment, and play with the 3D models, then it really improves your ability to understand what is the pathology, what it looks like.
Right, right. You mentioned earlier that it's not only patient-specific instrumentation, but also patient-specific implants, right? And Omer, I want to ask you, maybe this is something that you can touch on more specifically. If we're using these things as implants, right? Implants should be sterile. They're going to stay in the human's body. Are the materials that we're using for 3D printing things that we can put in an autoclave, or things that we can reuse, or things that we can sterilize effectively without denaturing it or damaging the structure? Or
Yeah, so this is one of the very critical considerations while designing a PSI, because as I said before, you have a lot of options in material, and also you get the freedom of designing specifically your implant so that it can be sterilized.
Hmm.
Because with 3D printing, you can print stuff that has some isolated chambers inside. Maybe
Yeah.
you're using powder technology, it's covered in powder. Some designs really cannot be translated to clinics because, yes, sterilization is a problem and
Right.
you want to be able to do it. And obviously, your material has to be biocompatible, and not every single 3D printing technology
Right.
is compatible with materials which are biocompatible also.
We also don't want to be adding any toxic material to human's body, right? Like,
That's-
this thing is
that's
going to
one of
stay there for years. You don't want the body to reabsorb it.
correct.
But I don't know if
This-
we need more also like studies on that or research on that.
I mean, there's a huge growing body of research looking at, the bodily reactions against 3D printed implants, their long-term effects, their biotoxicity. The options are growing, as we know, because we're having close collaborations with firms, companies in the industry who are actually dedicating their time to researching this, and they're trying to come up with alternatives, resins that are biocompatible, the other type of powders that are biocompatible, and in the future, definitely we're going to be seeing many other companies who are concerned with 3D printing try to cater to the medical side and try to expand their catalog of materials,
Right.
so that we can build implants, prostheses using a choice of these like different materials that they're offering.
Right. I think it's also something that just came up to my head is this, that like what if these what are these things in general? Like if we're 3D printing these things and we're keeping them in the body, the implants, it would be interesting to see if you can create something that's bioresorbable, right? Like something that you can put in and then it would just like the what do you call them? The bioabsorbable
Yeah,
screws? What do you call them?
bioabsorbable or biointegrable
Biointegrative, biodegradable,
yeah.
exactly.
So there are many materials in terms of like biocompatibility and also bioabsorbability, which is also a matter of question. When it comes to patient-specific implants, so they mostly do fill up a space that we want them to. In those cases, we don't want them to be just going away. That's why it's mostly metals that we want them. And we do have also 3D. I mean, the industry have 3D printing, 3D metal printers. So that's a part of it. But of course, if you have some kind of patient specific supports that you want them to be for a while and then go away, then that's also a good opportunity to put inside the body also, I think.
Right. Well, I mean, yeah, this is something that's very interesting, and I feel like our lab is gonna have a good time looking into and researching, especially with the new 3D printers that we've been having. So yeah, I mean, thank you so much, guys, for your time talking to us today about PSIs, and for all the listeners out there, maybe this would give them an idea and maybe spark some kind of ideas to go on with PSIs, and maybe inform them more about what's to come in this field, hopefully, especially in orthopedic surgery. Before we conclude this, I would like to hear your final thoughts on this. So, Bedri, why don't you just give us a few thoughts on where this is going, and maybe Omer, you can follow on that about like PSIs in general and more on the engineering background. So Bedri?
So I think like 3D printing and PSI is gonna revolutionize the surgical landscape because I think like as a surgeon you can just go inside the surgery and it's like you know that you can print whatever you want and it's a catalyst to like innovative ideas. So you can just easily explore your idea, prototype it and print it and use in the surgical field. But I think we need a lot of more research to kind of make sure that we are doing the best that we can, and also there are many gray areas that we still don't know. So there will be research collaborations from different centers with us. So me joining from Turkey also with our lab cast, we will as a part of FARIL International initiative, we will be doing a lot of multi-centric research about the clinical outcomes of those 3D patient-specific instrumentations and also 3D AR, VR applications that can help us through our surgery. So I hope we will be coming up with good evidence and also good methodology of the things that we can apply to make the best out of our surgeries.
Yeah. Well, I can't think of anyone better to do that, especially with someone like you, Bedri, especially as I've seen what you've been working on in person. So yeah, it's good to hear that, and I think the future of PSIs is in good hands. And Omer, why don't you tell us your final words on this, and maybe just touch a bit on cost effectiveness and how we can maybe further research that in the future as well.
Well, of course. So like one thing that's like critical in this discussion is we're going towards a digitalization. That's where the industry is going. And to design a patient-specific implant, you need to first have a digital twin of the area of interest, let's say the foot or the broken bone. And this is somewhat of a double-sided sword, because this, yes, delays the process a little bit in designing the implant, but you're opening the horizons on very efficient surgery planning, and having a digital model also allows us to build prototypes inside the computer, which we can test also there using finite element methods and simulations. So we can actually, before building something, biomechanically optimize the patient-specific implants for our case. And what this means right now, the steps in the workflow of going from the patient CT scan to finally fabricated solid implant, we have to do every step separately. And
optimize each step separately. as
So
well,
in the
right?
future, the communication between each step, going from segmented STLs of the patient to 3D modeling in a computer design software to finite element analysis for optimizing biomechanically, both in terms of mechanical properties and in terms of material, and then manufacturing, it will
Right.
be much more connected. Right now, maybe we do it in like a week, but in the future, when we build more connected technology regarding this, we can start with our only input will be the patient image, and
Right.
it will directly go through all these steps quickly and produce the biomechanically optimized implant that's going to
Mainly
work.
streamline the pipeline.
Streamline the pipeline.
Yeah,
That's
yeah.
where the whole
Don't
thing is
have
going.
it fragmented between you, me, and Bedri, and everyone doing one task. And
That's correct. And obviously,
then one day I won't do my job well, and I'll put you guys behind, and I'll bottleneck
I
the
mean,
process.
rapid,
Yeah, I
rapid
get it.
evolution of AI is going to
Yeah,
play a huge role in this as well.
definitely. So thank you guys for joining in today and giving us some insight on PSIs. It's a pleasure to have this first Kickstarter, and we're looking also. I just want to give a shout out for our FARIL International initiative that we have. Bedri, you're going to be leading that in Turkey soon.
Yeah.
We already have representatives in Belgium and in India. Hopefully, we're going to expand more and more to other places in the world. Thank you guys for your time here, and for the people who are listening, maybe you guys can give us some feedback on what to call this podcast. We still don't have any idea what we want to call it, and follow us for more, and thank you for tuning in.